Hello and welcome. Thank you for being here. My name is Lauren Dempsey from Malloy University, and we're located on Long Island in Nassau County, New York. Today, I'll share how our team is addressing the inequitable burden of asthma through a community-based education initiative. We are laser focused on preparing future nurses and respiratory therapists to deliver consistent, evidence-based education in real-world community settings. So let's get started. Today, I will focus on the problem, share our training model, report outcomes, and explain how this might be replicated in your community. Our program is built on strong collaboration. We partner with our Student Nurse Association, Respiratory Therapy Program, local schools, community organizations, and the American Lung Association through the New York State Children's Asthma Initiative. These partnerships allow students to lead outreach, while faculty and community partners provide structure and access. This makes the program both scalable and sustainable. So what do we want to do? Well, we set out to expand access, improve training by gathering student feedback, and increase opportunities for real-world application. Importantly, this project was designed as a hands-on experiential model. It included rapid feedback from faculty and student leaders and is not just a classroom learning experience. Pictured here are two students delivering asthma education at a summer event through the Mother Cabrini van. So why does this matter? Well, asthma remains a significant public health issue, and in New York, about 1 in 12 children are affected. Risk for asthma attack is not equal. In local high burden areas, community children with asthma represent 1 in 3 emergency room visits. Disparities are clear, with higher prevalence of ER visits and hospitalizations among Black and Hispanic children. Evidence shows that asthma education improves outcomes, but only when it is consistent and practiced. This is where students can make an immediate impact as future healthcare providers. This diagram outlines our goal, key drivers, and aligned interventions. This tool helped us organize our quality project. You can use it to develop a program in your community. We use PDSA cycles to refine the program with an aim of increasing trained students by at least 25% and improving confidence over time. Our interventions were focused on continuous improvement. We refined teaching methods with each session, scaled participation, and developed tools, including pre-post surveys, faculty guides, and structured student assignments. We also extended training to faculty and community partners to maintain consistency across settings. Happy to report that to date, we have trained more than 280 school nurses and a handful of teachers and ambulatory care nurses. This is a win for our team and the New York State Children's Asthma Initiative. Training day includes a pre-survey and case introduction, a brief didactic session, hands-on activity stations, and a post-survey with discussion. This structure allows students to immediately apply what they learn. We develop guided notes, pre-learning activities, and a faculty playbook to standardize delivery. Pictured here is our assignment and our Mad Lib style pre-learning activity, which I would like to note was created in collaboration with students who said, let's make this case study a lot more fun. Here we pictures a guide for faculty and the case study material to standardize facilitation. This ensures consistency across sessions and supports faculty in effectively facilitating hands-on learning. And this is a picture of our Mad Libs case study with the answers and the discussion questions. So how do we do this? Well, training begins with a brief session on asthma basics and core tools, setting the stage for hands-on work. Students can go to the American Lung Association's website to complete another activity called Asthma Basics and get a certificate for healthcare providers who want to deliver asthma education. They then rotate through 6 stations, spending about 10 minutes at each, where they practice medication techniques, spacer and device use, peak flow measurement. They apply the asthma action plan and identify triggers. They also practice patient education using the asthma flip chart. As they rotate, they receive real-time faculty coaching and answer reflection questions as a team. These pictures show our students in action. An example from our program is our trigger room activity, where students identify and address environmental risks. Pictured here is a handout the students get where they log what they see in this trigger room. At the bottom left corner of this screen is one example of a tool that goes into our student folders. They gather a handout at each station. This one is provided by the New York State Department of Health. You may be able to order similar resources from your public health department. Finally, students apply their learning through role play and case scenario. This flip chart provides a standardized scripted approach to asthma education, and we use it across a variety of healthcare settings in New York. This prepares our students to deliver consistent messaging in clinics, schools, and community environments. And the New York State Children's Asthma Initiative ambulatory clinics and hospital systems partners also appreciate that our students are ready to use the tool from day one when they begin their careers. This work extends directly into the community where students apply these skills in real-world settings. Here are 2 examples. One is a PTSA health fair, and the other is a wellness event at a high school. So how did we do? Well, I'm glad to report that we exceeded our goal. Over time, we trained more than 700 students with an 87% survey response rate. We made rapid growth possible because our nursing administration asked us to spread this to our community health course students almost immediately. And participation by partners in public schools also increased significantly, which supported school nurse training and led to an unexpected outcome in our project. Most importantly, while our program scaled quickly, we maintained quality by gathering continuous feedback, including both qualitative and quantitative data. Here is our handout with our information sheet. And this explained to the students what to expect if they were a participant in our project. And all students received education, and survey participation was anonymous and voluntary. So it didn't matter if they said yes or no, they still got the same education intervention. The same core questions were used across all settings, and they're aligned with the American Lung Association's flip chart program, and this enabled consistent evaluation. Rapid results guided didactic changes and indicated which information needed reinforcement across the curriculum. Among all trainees, one of the greatest improvements was understanding what happens during an asthma attack. To address this concept, we used the SET acronym: swelling, extra mucus, and tightening of airway muscles. SET simplified this concept significantly and improved understanding and retention. Notable changes were also observed in understanding the difference between quick and controller medications. Another win we observed included changes in confidence. By the end of training, 87% of participants felt confident using a peak flow meter, 90% felt confident using a spacer, and 85% reported that they knew how to complete an asthma action plan. This highlights the value of hands-on structured training since students were trained in their first clinical week. Faculty were then able to reinforce education throughout the semester. In summary, we trained over 700 nurses, 280 school nurses, and achieved strong engagement and improvement in both knowledge and confidence using asthma tools. Limitations include time constraints for training and the number of evening and weekend events we can schedule. We just have so much time. Importantly, because this initiative was designed as a quality project, results cannot be generalized. However, the model shows strong potential for replication in similar settings and will be used as a pilot for future research. Our work extends beyond education into advocacy. Students engage with the American Lung Association through events like legislative education days and community outreach at their Lung Force Walk. This builds leadership skills, interdisciplinary collaboration, and community trust. Pictured in the middle are me and our current co-president for the Malloy Nursing Student Association at Malloy at Advocacy Day this year. We are actively sharing work through conferences and presentations and community partnerships to support replication. Next up is a roundtable event in Utica, New York with Assemblywoman Marianne Butchinson. She is interested in creating her very own lung force team in her district. In summary, community engaged asthma education improves learner confidence and readiness. By training students in real world settings, we can address disparities and improve outcomes for persons with asthma. Resources are shared on the following slides. Thank you for attending this presentation today. We welcome collaboration and hope to hear from you soon.